So, Dr. Hafron, this is that moment I'm going to ask you to put on your hat to kind of use a crystal ball. I know you don't have one with you, but if you did have a crystal ball, how would you envision the future of PET scans? And how do you think how do you believe that therapeutics or theranostics, if you want to explain that to people, will actually play a role? And why is PET scan going to be that modality?
Yeah, I think we've touched on PET scan as an imaging or diagnostic test, and I'm glad you brought this up, Michael, because there's a whole nother box or exciting future about theranostics, and that's using PET-based imaging and PSMA-based radioligands to treat the cancer. So what does all that mean? Is basically we can take a PSMA, essentially antibody, bolt on a low dose or a beta radiation particle, or even a potential immunotherapeutic down the road, and we can have receptor specific treatments for the cancer. So imagine you have cancer, it's all labeled with PSMA. You treat the patient with a drug, and we have this drug, and we'll talk about it in a second, but you inject a drug, and the drug will actually just go to the cancer cells and emit a low-level radiation and kill those cells. That is like earth-shattering. So as we talk about, I think one of the only silver linings in this pandemic is that we've had, over the past 2 years, is an explosion in PET imaging. And just this past summer, we had a major trial readout called the Vision trial, which is a groundbreaking trial. It was in New England Journal. Dr. Starter was the lead author, covered in the New York Times. This is a complete different paradigm or platform to treat prostate cancer. And it's very exciting.